Hi everyone, I welcome you all for this Nursing Wisdom channel. Today we are going to see about OBG MCQ for nursing competitive exams. First question, Sheela comes to the ANC clinic for her second antenatal visit. Her history is suggestive of 2 previous abortion and 1 term delivery. Her gravida and parity is option A G1P1, option B G2P1, option C G3P1, option D G4P1. Sheela has history of 2 abortion, 1 term delivery and presently she is pregnant. Totally 4 times she became pregnant. So gravida is 4 and she has 1 term delivery. So para is 1. So here the answer is option D G4P1. Next question, G3P1 plus 2 means option A 3 times pregnant with 1 viable birth and 2 abortion. Option B 3 times pregnant with 1 abortion and 2 viable birth. Option 3 times pregnant with 1 single baby and 2 twins. Option D 3 times pregnant with 1 twin delivery and 2 abortion. G3P1 plus 2 meaning G means gravida, number of times she becomes pregnant. Here G3 means she become pregnant for 3 times. P means parity, number of times she delivered. Here 1 after P indicate term delivery, 2 indicate miscarriage. So here 3 times she become pregnant, 1 term delivery and 2 miscarriage. So here the answer is option A 3 times pregnant with 1 viable birth and 2 abortion. Next question, grand multipara is option A pregnant woman with previous history of 4 or more birth. Option B pregnant woman with the first pregnancy at the age of 30 or above. Option C pregnant woman with the previous history of 2 abortions. Option D woman with pregnancy at the age of 18 years. Grand multiparity is a mother who has had 5 or more than 5 births, includes live birth or stillborn, at 20 or more than 20 weeks of gestation. So here the answer is option A pregnant woman with previous history of 4 or more birth. Next question, nullipara is option A one who never completed the pregnancy beyond the stage of viability. Option B one who never become pregnant. Option C one who become pregnant for the first time. Option D one who is pregnant for more than one time. Nullipara, a woman who has never carried a pregnancy beyond the period of viability. So here the answer is option A one who never completed the pregnancy beyond the stage of viability. Next question, formula used for calculating expected date of delivery, EDD. Option A Johnson's formula. Option B Shepard's formula. Option C Hadlock's formula. Option D Naegele's formula. EDD is calculated by using Naegele's formula by adding 7 days and 9 months to the first day of last menstrual cycle. So here the answer is option D Naegele's formula. Next question, calculate EDD if LMP was 7th May 2016. Option A 14th February 2017. Option B 14th January 2017. Option C 13th February 2017. Option D 13th January 2017. Here LMP is 7th May 2016. By adding 7 days we will get 14 May 2016. By adding 9 months we will get 14th February 2016. If LMP is in January, February, March means no need to add 1 year because EDD comes in same year. For remaining months we have to add 1 year. By adding 1 year we will get 14th February 2017. So here the answer is option A 14th February 2017. Next question, the components of triple test includes option A maternal serum alpha fetoprotein, option B HCG, option C unconjugated estriol, option D all the above. Maternal serum alpha-fetoprotein (HCG) and unconjugated estriol are the components of triple screening, which help us to find out Down syndrome, neural tube defect, and other chromosomal abnormality present in the fetus. It is performed between 15 and 18 weeks. So here the answer is option D, all the above. Next question, WHO recommended minimum antenatal visit in the developing country is option A 3, option B 4, option C 6, option D 8. The WHO recommends at least 4 antenatal care visits on the basis of effectiveness of the healthcare system. It promotes institutional deliveries, less maternal mortality, and incline of child survival. So here the answer is option B 4. Next question, identify the incorrect statement regarding immunization in pregnant women. Option A, live vaccines are contraindicated in pregnancy. Option B, immunization against tetanus can be given. Option C, tetanus immunization protect both mother and baby. Option D, 3 doses of tetanus, 1 in each trimester is recommended. Option A, live vaccines are contraindicated in pregnancy. It is correct statement because live vaccines during pregnancy carry a risk of infection to the unborn baby. Next option is immunization against tetanus can be given. This is correct statement. Option C is tetanus immunization protect both mother and baby. This is also correct statement. Next option is 3 doses of tetanus, 1 in each trimester is recommended. This is not correct statement because 2 doses of TT immunization is recommended at 6 weeks interval. So here the answer is option D, 3 doses of tetanus, 1 in each trimester is recommended. Next question, elevated level of maternal serum alpha-fetoprotein AFB is seen in all the conditions except option A, open neural tube defect, option B, RH isoimmunization, option C, anterior abdominal wall defect, option D, Down syndrome. Elevated maternal serum alpha-fetoprotein is present in open neural tube defect, RH immunization, anterior abdominal wall defect. In Down syndrome and gestational trophoblastic disease, maternal serum alpha-fetoprotein will decreases. So here the answer is option D, Down syndrome. Next question, appropriate time for chorionic villus sampling is option A 10 to 12 week, option B 14 to 16 week, option C 18 to 20 week, option D 20 to 22 week. Chorionic villus sampling is usually done between 10th to 12th week of pregnancy. So here the answer is option A 10 to 12 week. Next question, identify correct statement regarding non-stress test NST. Option A, continuous monitoring of fetal heart rate along with fetal movement cardiotocography. Option B, it will assess the relationship between fetal movement and heart rate. Option C, FHR acceleration along with fetal movement is expected. Option D, all the above. Here, the first option is continuous monitoring of fetal heart rate along with fetal movement cardiotocography. This is correct statement. Option B is it will assess the relationship between fetal movement and heart rate. This is also correct statement. Option C is FHR acceleration along with fetal movement is expected. This is also correct statement. So here the answer is option D, all the above. Next question, criteria for normal labor. Option A, spontaneous in onset. Option B, vertex presentation. Option C, without undue prolongation. Option D, all the above. Here we will see the criteria or characteristics of normal labor. Spontaneous in onset and at a time between 37 to 40 weeks of gestation with vertex presentation without any undue prolongation, without any complication and naturally terminated with minimal aid. So here the answer is option D, All the above. Next question. A client is in active labor with twins and the cervix is 5 cm dilated. The nurse observes that contractions occurring every 7 to 8 minutes in a 30-minute period. The most appropriate action by the nurse would be to option A. Administer oxygen at 4 liters by mask. Option B. Note the fetal heart rate patterns. Option C. Notify the physician immediately. Option D. Instruct the client to relax during the contraction. Here we will see the characteristics of uterine contraction. In first stage latent phase, the uterine contraction has to come in every 5 to 10 minutes and last for 20 to 35 seconds. In first stage active phase, the contraction will come in every 3 to 5 minutes and will last for 40 to 55 seconds. In second stage, the contraction will come in every 2 to 3 minutes and last for 55 to 65 seconds. Here, the mother is in first stage active phase, so the pain and contraction has to come in every 3 to 5 minutes and has to last for 40 to 55 seconds. But mother is getting contraction at every 7 to 9 minutes. So the client is mostly like experiencing hypotonic uterine contraction. The nurse must notify physician immediately. The usual treatment is oxytocin administration unless cephalopelvic disproportion exists. So here the answer is option C. Notify the physician immediately. Next question. Which sign is considered as welcome sign in pregnancy? Option A. Lightening. Option B. Show. Option C. Onset of labor pain. Option D. Quickening. Lightening is considered as welcome sign of pregnancy. Lightening occurs when the baby settles deep in the pelvis near the time of birth. Pressure on the upper abdomen is reduced, dropped, occur days or weeks before labor in first pregnancy, occurs just before labor in second plus pregnancy. So here the answer is option A, lightening. Next question. All are the characteristics of true labor pain except option A. Intensity and duration of contraction increases progressively. Option B. Associated with the show. Option C. Progressive effacement and dilation of cervix. Option D. Pain is felt more in the front of abdomen and radiating to thighs. Here we will see the characteristics of true and false labor pains. True labor pains, regular, increase gradually in amplitude, frequency and duration. Hardening of the uterus will be there. Progressive dilation and effacement of the cervix will be there. And membrane and bulging during contraction. Discomfort in back and abdomen will be present, accompanied by progressive dilatation of the cervix. Pain not affected by sedatives. Pain enhanced by enema. False labor pain. The pain will be irregular in amplitude, frequency and duration. No hardening of the uterus. No effect on the cervix. No bulging of the membranes. Discomfort is lower abdomen. No progressive dilatation of cervix. Pain affected by sedatives and pain not enhanced by enema. So here the answer is option D. Pain is felt more in the front of abdomen and radiating to thighs. Next question. Which of the following local findings is expected during the first 24 hours post-delivery? Option A. Absence of lochia. Option B. A greenish discharge with foul odor. Option C. Bright red color. Option D. Large clots with lochia. Here we will see the characteristics of lochia. Lochia rubra, color red, postpartal day 1 to 3, composition, blood fragments of decidua and mucus. Lochia serosa, pink in color, postpartal day 3 to 10 days, composition, blood, mucus and invading leukocytes. Lochia alba, white in color, postpartal day 10 to 14 days, may last up to 6 weeks and composition largely mucus, leukocyte count will be high. So here the answer is option C, bright red color. Next question. Pacemaker of uterine contraction is option A tubal ostia, option B SA node, option C AV node, option D Purkinje fibers. Tubal ostia is the pacemaker of uterine contraction. So here the answer is option A tubal ostia. Next question. A preemie gravida client at 25 weeks gestational visits the clinic and tells the nurse that her lower back aches when she arrives home from work. The nurse should suggest that the client perform option A leg lifting, option B tailor sitting, option C side lying, option D squatting exercises. Tailor sitting. Sit on the floor as much as possible this way. Opens up pelvic area for birth. Completely replace crossing one leg over the other. Takes pressure off your back, leg and ankle swelling will go down. So here the answer is option B tailor sitting. Next question. All among the following are principal movements occur during labor except option A engagement, option B retraction, option C crowning, option D restitution. Cardinal movements of labor: descent, flexion, internal rotation, extension, external rotation and expulsion. So here the answer is option B retraction. Next question. When the membrane rupture before the onset of labor is called option A early rupture, option B premature rupture, option C adequate rupture, option D artificial rupture. The membrane rupture before the onset of labor is called as premature rupture of membrane. So here the answer is option B premature rupture. Next question. Fifth formula is used for assessing option A uterine contraction, option B progressive descent of the head, option C fetal well-being, option D labor pain. Descent of the head is measured by abdominal palpation and expressed in terms of fifths above the pelvic brim. It is found to be a more reliable way of gauging descent than vaginal examination. So here the answer is option B progressive descent of the head. Next question. A client is scheduled for amniocentesis. When preparing her for the procedure, nurse should go which of the following? Option A ask her to void, option B instruct her to drink 1 liter of fluid, option C place her on her left side, option D prepare her for IV anesthesia. Voiding will decrease the discomfort for doing procedure. So here the answer is option A ask her to void. Next question. Which of the following drug is administered when a postpartum client who is receiving heparin for thrombophlebitis develops complication related to heparin therapy? Option A vitamin K, option B calcium gluconate, option C protamine sulfate, option D aspirin. Protamine sulfate is a heparin antagonist. It is administered intravenously to counter the bleeding complications precipitated by heparin overdose. So here the answer is option D protamine sulfate. Next question. Station of the head is expressed in relation to option A ischial spine, option B pelvic brim, option C cervix, option D pelvic inlet. Station of the head is expressed in terms of ischial spine. At the level of ischial spine is termed as zero station, above which it is indicated in terms of negative numbers such as -1, -2, -3, and below which is positive numbers such as +1, +2, +3. So here the answer is option A ischial spine. Next question. Normal range of fetal heart rate is option A 80 to 100, option B 110 to 150, option C 120 to 170, option D more than 150. Normal fetal heart rate range. Baseline fetal heart rate is 120 to 160 beat per minute, bradycardia below 120 beat per minute, tachycardia above 160 beat per minute. So here the answer is option B 110 to 150. Next question. All among indicate transition from first stage to second stage except Option A, increase intensity of uterine contraction. Option B, urge to defecate with the descent of the presenting part. Option C, complete dilation of cervix. Option D, relaxation in mother. Option A, increase intensity of uterine contraction. The uterine contraction will gradually increases, so this is correct statement. Next option is urge to defecate with the descent of the presenting part. This is also correct statement. Option C, complete dilatation of cervix. The cervix will dilate to 10 cm. This is also correct statement. Next option is relaxation in mother. Mother will not relax in this phase. She has to expel the fetus out. In that manner she will be there. So this is not correct statement. So here the answer is option D, relaxation in mother. Next question, delayed cord clamping is contraindicated in option A, baby born to anemic mother. Option B, baby with birth weight more than 3 kg. Option C, RH incompatibility. Option D, preterm baby. Contraindication of late clamping: placenta abruption, multiple gestation, specifically monochorionic gestation, isoimmunization and hydrophytalis, severe fetal bradycardia or other indication for need of immediate resuscitation, fetal anomalies. So here the answer is option C, RH incompatibility. Next question, a nurse is caring for a 16-year-old pregnant client. The client is taking an iron supplement. What should this client drink to increase the absorption of iron? Option A, cup of hot coffee. Option B, a glass of milk. Option C, a glass of orange juice. Option D, antacid solution. Vitamin C supplement or drinking orange juice will help to increase iron absorption. Iron is best absorbed on an empty stomach, yet iron supplements can cause stomach cramps, nausea and diarrhea in some people. You may need to take iron with a small amount of food to avoid this problem. Milk, calcium and antacid should not be taken at the same time as iron supplements. You should wait at least 2 hours after having these foods before taking your iron supplements. So here the answer is option C, a glass of orange juice. Next question, which bone is the part of pelvis? Option A, innominate bone. Option B, sacrum. Option C, coccyx. Option D, all the above. Pelvis is composed of 4 bones, 2 innominate bone, sacrum and coccyx. So here the answer is option D, all the above. Next question, duration of puerperium is option A, 3 week, option B, 4 week, option C, 5 week, option D, 6 week. Puerperium is the period following childbirth. It begins as soon as the placenta expelled and lasts for approximately 6 weeks. So here the answer is option D, 6 week. Next question, lochia secreted following delivery is 1 to 4 days is known as option A, lochia rubra, option B, lochia serosa, option C, lochia alba, option D, leucaria. Types of lochia: lochia rubra. Initially the discharge is grossly bloody, persisting for 3 to 4 days. It contains large amount of blood. Lochia serosa, it then decreases in volume and changes to pale brown and become thinner, persisting for 10 to 12 days. It contains serous exudate, erythrocytes, leukocytes and cervical mucus. Lochia alba, finally the discharge becomes yellowish white, occasionally tinged with blood and may persist for several weeks. It contains leukocytes, epithelial cells, cholesterol, fat and mucus. So here the answer is option A, lochia rubra. Next question, major galactokinetic hormone is option A, oxytocin, option B, prolactin, option C, estrogen, option D, progesterone. Oxytocin is the hormone which helps in milk ejection, so it is considered as major galactokinetic hormone. So here the answer is option A, oxytocin. Next question, letdown reflex is also known as option A, milk secreting reflex, option B, milk ejection reflex, option C, rooting reflex, option D, sucking reflex. Letdown reflex is also known as milk ejection reflex. It is produced by oxytocin hormone. It helps in the milk ejection from breast tissue. So here the answer is option B, milk ejection reflex. Next question, lochia is option A, change in vital signs after delivery, option B, vaginal discharge after giving birth, option C, going back of the body to pre-pregnant state, option D, decrease in pigmentation. Lochia is the vaginal discharge after giving birth. It contains blood, mucus and uterine tissue. Lochia discharge typically continues for 4 to 6 weeks after delivery. So here the answer is option B, vaginal discharge after giving birth. Next question, drug used to improve the milk production is option A, metoclopramide, option B, sulpiride, option C, both A and B, option D, dopamine. Metoclopramide 10 mg TDS will improve the milk production by increasing the prolactin level. Sulpiride also found effective to increase breast milk production. So here the answer is option C, both A and B. Next question, hormone responsible for morning sickness is option A, HCG, option B, oxytocin, option C, prolactin, option D, relaxin. High level of serum HCG, estrogen and altered level of immunological state are considered as responsible for morning sickness. So here the answer is option A, HCG. Next question, when the fetus is dead and retained inside the uterus for a variable period is called as option A, missed miscarriage, option B, incomplete miscarriage, option C, complete miscarriage, option D, inevitable miscarriage. Missed miscarriage, when the fetus is dead and retained inside the uterus for a variable period, it is called missed abortion or silent miscarriage or early fetal demise. Incomplete miscarriage, when the entire products of conception are not expelled, instead a part of it is left inside the uterine cavity, it is called incomplete abortion. Complete miscarriage, when the products of conception are expelled, it is called complete abortion. Inevitable miscarriage, it is the clinical type of abortion where the changes have progressed to a state from where continuation of pregnancy is impossible. So here the answer is option A, missed miscarriage. Next question, cerclage operation is the surgical management of choice for option A, cancer cervix, option B, cervical incompetence, option C, fibroid uterus, option D, hydatidiform mole. Cerclage operation. Cerclage operation is the surgical management of cervical incompetence. A non-absorbable encircling suture is placed around the cervix at the level of internal os. It operates by interfering with the uterine polarity, preventing the internal os and the adjacent lower segment from being taken up. So here the answer is option B, cervical incompetence. Next question, in which year for the first time MTP Act legalized in India? Option A, 1970, option B, 1971, option C, 1972, option D, 1975. For the first time, it was legalized in India in the year of 1971. It again enforced in the year 1972 and its provisions revised again in the year of 1975. So here the answer is Option B 1971. Next question is synonymous of obstetric grip is option A Leopold maneuvers, option B fundal grip, option C umbilical grip, option D Paulick's grip. Obstetric grip also known as Leopold maneuvers, which includes the following grips. They are: first one is fundal grip, otherwise called as first Leopold maneuver. Second one is lateral grip, otherwise called as umbilical grip and second Leopold maneuver. Third one is first pelvic grip, otherwise known as fourth Leopold maneuver. Fourth one is second pelvic grip, otherwise known as Paulick's grip, and third Leopold maneuver. So here the answer is option A Leopold maneuvers. Next question is the suture lies between two parietal bone is known as option A sagittal suture, option B longitudinal suture, option C coronal suture, option D both A and B. Suture lies between two parietal bone is known as longitudinal suture, which is also known as sagittal suture. So here the answer is option D both A and B. Next question is identify correct statement regarding anterior fontanel. Option A formed by joining four sutures in the midline. Option B shape is like a diamond. Option C ossified by 18 months of age. Option D all the above. Anterior fontanel, it is formed by joining of four sutures. They are anteriorly frontal, posteriorly sagittal, and on either side coronal. The shape is like a diamond. It become ossified by 18 months after birth. So here the answer is option D all the above. Next question, identify the correct statement regarding posterior fontanel. It is formed by three sutures. Option B triangular in shape. Option C it generally closes in 6 to 8 weeks from birth. Option D all the above. Posterior fontanel, it is formed by junction of three sutures lines, sagittal suture anteriorly and lambdoid suture on either side. It is triangular in shape. It generally closes in 6 to 8 weeks from birth. So here the answer is option D all the above. Next question, formation of swelling due to stagnation of fluid in the layers of scalp beneath the girdle of contact is option A molding, option B caput succedaneum, option C hemangioma, option D hematoma. Molding, it is the alteration of the shape of the forehumming head while passing through the resistant birth passage during labor. Caput succedaneum, it is the formation of swelling due to stagnation of fluid in the layers of the scalp beneath the girdle of contact. Hemangioma, a hemangioma is a bright red birthmark that shows up at birth or in the first or second week of life. It looks like a rubbery bump and is made up of extra blood vessels in the skin. A hemangioma can occur anywhere on the body, but most commonly appears on the face, scalp, chest or back. Hematoma. A hematoma is a bad bruise. It happens when an injury causes blood to collect and pool under the skin. The pooling blood gives the skin a spongy, rubbery, lumpy feel. A hematoma usually is not a cause for concern. It is not the same thing as a blood clot in a vein, and it does not cause blood clots. So here the answer is option B caput succedaneum. Next question, most reliable indicator of true labor is option A effacement and dilatation of cervix, option B painful uterine contraction, option C suprapubic discomfort at regular interval, option D all of the above. False versus true labor. False labor, contraction irregular, walking relieves contraction, bloody show usually not present, no change in effacement and dilatation of cervix. True labor, Contraction gradually develop a regular pattern. Contraction becomes stronger and more effective with walking. Discomfort in lower back and abdomen. Bloody show often present. Progressive effacement and dilatation of cervix will be present. So here the answer is option A, effacement and dilatation of cervix. Next question, which of the following position should the nurse place the client when the epidural regional block is administered? Option A, lithotomy. Option B, supine. Option C, prone. Option D, lateral. While the epidural regional block is administered, the nurse should place the client in either sitting position or lateral position. So here the answer is option D, lateral. Next question is, true pelvis can be divided as option A, inlet, option B, cavity, option C, outlet, option D, all the above. True pelvis divided into inlet, cavity and outlet. So here the answer is option D, all the above. Next question, gravida indicate option A, pregnancy state both present and past. Option B, state of previous pregnancy beyond the period of viability. Option C, denote the number of babies have. Option D, all the above. Gravida. Gravida indicates the number of times a woman is or has been pregnant regardless of the pregnancy outcome. So here the answer is option A, pregnancy state both present and past. Next question, Roma is pregnant for the first time and at 12-week POG. Her USG is suggestive of twin pregnancy. Her gravida is option A, gravida 0, option B, gravida 1, option C, gravida 2, option D, gravida 1 plus 1. Gravida indicates the number of times a woman is or has been pregnant regardless of the pregnancy outcome. A current pregnancy, if any, is included in this count. A multiple pregnancy like twins, triplets is counted as 1. So here the answer is option B, gravida 1. I hope you got understand. Thanks for watching.